I'd love to talk about where that came from. Like, where did this idea come from? Is this something you've heard from GPs themselves? I mean, you're a clinician by background like me, right? What was the birth of this idea? What led to Smart Triage?
Honestly, the birth of this idea came from both working in general practice and seeing other GPs spend all their day triaging requests as they're coming in, no matter how complex or how simple they are. And often a lot of the feedback we've heard from GPs was that they felt very overwhelmed, that they had a lot of demand coming in, especially after the April 1st contract changes this year. A lot of the things coming in do require quite a lot of experienced medical consideration, but a lot of stuff coming in actually is fairly straightforward. And we estimate about 30% of all this could potentially be automated. And if we could remove that 30% of requests from the dashboard, that would A, make them feel like they're having a better day at work, and B, get the patients who are requesting that care a faster way to be able to access that.
I mean, it'd be great if we could have a look at the product.
Yeah, of course. So from the clinician side of things, this is kind of the view of the dashboard and the settings for our automations. You'll notice that we have the ability to customize automations, not just for our triage product, but also all our various other product lines. Now you'll notice that what we've got on currently are the pharmacy first automations. You'll see 1 of 7 is enabled, and I turned this on a little while ago now. And you'll see all the other various options that I have off for now, but I can turn on if I so wish. I'll take the pharmacy first one as an example to begin with, because it's quite easy to understand, because the criteria are very well defined by the NHS and the referral is appropriate. And if I go into this, you'll see the previous 7, soon to be 12, different conditions that can be referred to a community pharmacy. You'll notice that uncomplicated urinary tract infections is one of them down here, and I've got that enabled. If I expand that here, it'll explain to me exactly when and what inclusion criteria are included in this automation, and what are the exclusion criteria, i.e. it doesn't match. We, as at Anima, will provide you these buckets to choose from, i.e. these inclusion-exclusion criteria, because it's often very time-consuming and labor-intensive to create them all from scratch one at a time. We've got the benefit of processing about 1 million requests every single month through our platform. And so we're able to do and extract out these various kind of clusters and groups of things that often require similar actions. But I'll stick with pharmacy first because it's very well understood. And you'll see the inclusion-exclusion criteria here. And what I can do here is set up an action. This could be a referral to a community pharmacy, or it could be something else. Here for pharmacy first, the most appropriate referral probably would be to a community pharmacy. If I expand some of these out, you can see I can turn some of these on, turn some of these off, and all the inclusion-exclusion criteria are the same as the NHS for the pharmacy first automation here. So from the patient point of view, you'll see something like this to begin with. This is our standard web portal that I'm sure all of our viewers might be already familiar with, but our approach to submitting online consultations is that we give patients a free text box to type in whatever they'd like help with. So if I type in something like burning and stinging when peeing here, our systems actually recognize what symptoms that your people are describing, and then pick out the appropriate follow-up questionnaire. And so we use AI to do that, but we do this in a, we think, responsible way, by always making sure that we provide them a questionnaire that's been previously clinically validated and made sure that we ask all the right questions. So if I start this questionnaire now, and I answer some of these questions, because I've got the uncomplicated UTI automation on, I'll just quickly whiz through some of these questions, making sure I hit some of the appropriate pharmacy first.
And these questions, just kind of talking it through, these are clinical questions that is the same as a clinician would ask in a history, right? If someone came into your doctor's surgery, that you're able to kind of actually triage on the spot as these questions go through.
Exactly, yeah. So we collect all this information because it allows clinicians to be able to save on patient time and prevent it taking too long by asking too many questions.
Yeah.
We try and ask all the right questions that would be really useful for a doctor when triaging. We do allow clinicians to then ask follow-up questions and send messages back and forth. We do a bunch of data analysis on some of that so that we can integrate some of those questions within our questionnaires. The idea being that whenever these requests come into a clinician's dashboard, you have all the information you need to make a clinical decision there. There's no uncertainty as to what needs to be done. And you have the ability to make that decision in one pass rather than need to go back and forth and ask more.
And the phrase I've heard you use before is a complete history, right? You know, when you're in a medical context, you're trying to take a complete history so that you don't need to go back. And as you said, you can go back. But the idea here, right, is that the questions that are asked successively are dependent on the context given before. So by the time you get to the end of your 10 or 11 questions, you have that complete history of the patient.
So yeah, I'll skip this question, and you'll see that suddenly there's this special question that gets asked because I've turned on the uncomplicated UTI automation. And it asks the patient would they like to be seen by a pharmacy instead to get seen more quickly. And if I click yes here, I'm able to search for my local pharmacies, and you'll see a list of all the pharmacies from the NHS. Once I select one, I'll get the summary of everything I've entered, and if I press submit, instead of going to the GP practice, it'll actually go straight to Boots Pharmacy here. And then that actually sends a referral using the booking and referral standard from the NHS straight through to the pharmacy that's been selected.
So the GP will have a record of the fact that you've logged a request and that it's automatically gone to the pharmacy. So if, for example, I went to the pharmacy, I picked up some antibiotics for the UTI, and in a week's time it still hadn't sorted itself out, the GP will have the record.
Be aware, yeah.
Okay, and this was quite a quick process end to end, right?
Yeah, so if we go back to the automations dashboard, you notice that these are the pharmacy first automations that we have enabled because these are quite well recognized within the NHS. But as we know as clinicians, there's a lot more kind of nuance to stuff that may be automatable in a triage decision. So if you take back pain, for example, here, we've actually analyzed all of our questionnaires and we split them up into these sub-buckets. So for example, back pain, we've got non-specific mechanical back pain and back pain with leg or nerve symptoms. You can see that we've got the inclusion-exclusion criteria here for each of these buckets. And what we can do is actually select an action that we want to happen. So Anima will surface these buckets, and then you as a practice or a clinician can actually determine what action will be taken based on when the patient falls into these buckets. For example, a non-specific mechanical back pain, we might want to assign it to the first contact physio team, or maybe we want to signpost them to another service. A lot of these things will be very practice dependent, and so we want to allow for the flexibility for practices to customize the system enough to meet the needs of the local population while not being too overwhelming that there's too many things to choose and too many ways to kind of select the same thing. So if you look here, then we've got the ability to self-book an appointment, i.e. offer the patient the ability to book an appointment into your existing electronic health record. And now this isn't just going to make every slot that's in your electronic health record available. You're actually, as a practice, able to choose which types of slots patients are able to book into. So for example, you may have a cervical smear slot, for example, and you can associate the cervical smear request type with a cervical smear appointment slot. And then patients can just book themselves into your appointment books directly, but only in the slots that you specified.
So thanks very much for coming in, Souradip, and talking about Smart Triage. I'm really excited to see it come together. Thanks very much for the chat, Souradip. See you later.
See you soon.